Good morning. I'm Susan Witkowski, the CEO of the Community Medical Clinic, and I am thrilled, beyond thrilled today to be on this amazing farm here in Kershaw County with all of our friends that help us with our food system. Yes, did you know you were part of a food system? That's one of our goals and objectives today, to have people realize that everyone in this room and then some are part of a food system and what we do to help create healthy access to food. So it is my pleasure here today to be here. I have been praying and working with Reverend Richard Joyner from Canida, North Carolina, to be able to come here. So we're just thrilled. He was able to make that 10-hour journey from North Carolina. Okay, people, that's an inside joke. It doesn't take 10 hours to get from Canada. But you know, those of you that live in the country, that it's really hard to get somewhere from nowhere. It could feel like 10 hours. It might have taken you 10 hours if you rode your bicycle, right? If you cycled. Yeah. All right, great. Okay, so a couple things you need to know today. Everybody turn around and wave to Kirk Mays. Hello, Kirk. We are so thrilled to have him here today because we are experimenting and we are live. Yes, you all are movie stars today. We are live on Facebook and live on Watch SC TV, right, Kirk? That's right. And Carrie, wave to Carrie. Carrie Boyce with KB Communications, our marketing communications extraordinaire, is going to be snapping pictures. So if you really are opposed to having your picture taken and you don't want it on Facebook, let her know, okay? Because she's going to be snapping all day. The person that is over here who is an expert doodler, colorist, creative extraordinaire, Holly Hayes with Iron Sharpens Iron. She's going to continue to draw a visual as we talk this morning. I'm happy to have her with us today. And some of our other speakers as we get started, Katherine Johnson from Live Well Coalition, Pam Spivey from United Way and Eat Smart Move More, Donnie Sipley, the CEO and President of United Way. Those are our speakers for today. So we're going to get started with why was it so important to do this today? And I'm going to hand off this mic, and I'm going to give it to Katherine. But I'm going to start off, and the folks that are sponsoring this today is Eat Smart Move More, Live Well Kershaw Coalition, United Way of Kershaw County, and Jane Arnold. So it was really important for you to understand why was it important for these folks to sponsor this today. So I'll kick off with saying that it was important for the Community Medical Clinic to host this today, to present this today, for two reasons. Our mission in the Community Medical Clinic of Kershaw County is twofold. One is to provide direct services. We are treating people with chronic disease, acute disease, all day long. And then we also are very motivated to improve population health. So we want to be able to lead the way, collaborate any way we can to help everybody move in the direction of culture of health through our Live Well Kershaw Coalition that we get funding for through the Duke Endowment. So that's really important. So why? Why is that? Part of this is part of improving population health, but we treat chronic disease, and for me personally, it's 38 years of working in healthcare, and we haven't moved the needle but a teeny smidgy little bit. So I'm tired of seeing people lose a leg to diabetes. I'm tired of people who are dying of kidney disease. And I think it's really important to really think about food as medicine. Food is medicine. And we don't need to go to a pharmacy, P-H-A-R. We need to go to a pharmacy, F-A-R-M. That's why we're here today. So that's my why. And then I'm going to let Katherine speak her why for Live Well, and then we'll have Pam and Donnie, and then we'll hear from Jane from Carrie. Okay.
Good morning. So again, my name is...
Hang on.
we've got two mics going on today. But good morning. Again, my name is Katherine Johnson. I'm the director of the Live Well Kershaw Coalition, and my why today relates directly to the work that we've been doing with the high school youth in our county. We're working with all 3 high schools as well as Camden Military Academy, and really working on empowering youth to live healthy lifestyles and equipping them with the tools and resources that they need to be a part of this process with us. So that's why I'm here today.
Hi, I'm Pam Spivey with Eat Smart, Move More, No. Susan, did it go turn off? Better? Hi, I'm Pam Spivey with Eat Smart, Move More, Kershaw County. And my why is because we have to change the fact that at approximately one third of our adults and 1/3 of our children are overweight or obese in this state. Obesity leads to chronic disease. Chronic disease is responsible for about half the deaths in this state. We can together make that better. On a personal note, as little as 7 years ago, I got up and ran 4 or 5 miles, got to work by 8, felt fantastic, life was good, and since that time I've had 2 back surgeries, a hip replaced, hand surgery, foot surgery. I face a lot of osteo issues. They're going to continue, but I need to be the best I can be. So we all have things that maybe genetically we're predispositioned to, but we need to be all we can be and who we were created to be. That's my why. Thank you. I will. Okay.
Thank you. Oh, no.
Uh-oh.
Sorry, Kirk.
We have lots of mics.
Sorry, Kirk. I promise I didn't drop that. My why dates back several years to 2008. Reverend Griffith, many of you know. Frank Morgan, many of you know. Donnie Weeks, Karen Eckford, and several other community leaders came together, and in 2008 we were challenged as a United Way to form some goals and objectives for the future for 10 years. And as 2018 began to approach, we started looking at the hunger issue, and we really even changed care councils. We have 4 care councils, but we changed from homelessness and hunger to health and hunger, because Pam and Eat Smart Move More and Susan with the medical clinic really helped us understand more about the fact that hunger is a health issue. And Pam has really added, and Susan as well, and others have added that nutrition is important. It's not just feeding people, but it's feeding people nutritious things. As I was seeing Cocoa Krispies up there, I can relate to that. I'm guessing we might get to the fact that Cocoa Krispies are probably not my best choice, but I appreciate you putting them up there. In about a year ago, we were in a December board meeting. It was about 2 years ago. And Dr. Frank Morgan was asked a question, aren't you glad that the kids are getting out for a couple of weeks in December for break? And he said, no, I'm really concerned about them being hungry. And it hit a bunch of my board members really hard. And they said, and I think Susan just mentioned it, incremental change is not acceptable. For us to make a little bit of progress is not okay. We've got people that really need it now. And we've seen homeless folks die. We've seen people lose legs, as Susan said. We've seen people that are not going the direction they need to go. And so I'm excited today. The why for me is that together we can indeed make a difference. And so I'm excited about that difference we're going to make.
Thank you. Thank you, Donnie, Pam, Catherine, and now Jane Arnold could not be with us today, but we went ahead and recorded her why already. So, Carrie, if you played Jane Arnold, that would be great. Isn't technology something? 2 mics, 3 mics, Facebook. Here we go.
Hi, I'm Jane Arnold, and I am proud to sponsor the Way We Eat event tonight. It is especially meaningful to me because having worked in our family business, which is Southern Concrete Materials. It's a ready-mix business and an aggregate business. Our plants and locations are spread out all over rural North and South Carolina, and so many of our employees were in need of a program like this. Last summer, I went on a wellness tour with the clinic, and we went to various schools and churches that were within Kershaw County, and I was absolutely amazed at how vast and how under treated some of the areas are as far as medical assistance and wellness information. And like other companies, we were having problems with wellness, and we recognized that so much of how we perform and how we feel is connected to the way that we eat. When I went on the tour, it struck a chord with me. It was so much like the business that I've been working in, and it was obvious that these individuals would benefit from a wellness program. I was particularly impressed with Catherine Johnson and what she is doing in the schools, because that's where it starts. It starts with these young people, and that's the education part. And it's so much easier to tell somebody and to educate them when they haven't developed serious bad habits as adults. And this is so important, the work that she's doing on physical and mental health wellness within the schools. And then I'm excited about Reverend Joyner, because he is going to teach us how to overcome these food deserts and to provide good, nutritious food. And I think that's really wonderful. I like the idea of teaching little children to garden, and they'll probably like carrots as much as potato chips if they had grown them. So I noticed on my wellness tour and at McCaskill's farm a variety of individuals who are truly concerned from all walks of life in this community. That's why I'm confident that it will succeed and that we will be able to do this, because everybody there had special talents and special fields that they work in, and that is going to be I think the thing that ties all of this together. And not only will it benefit the people in these food deserts, but it will benefit the community as a whole, and that I think is a very special thing.
So great. So we've got some whys from our sponsors, and people are presenting, and so now this is the portion of the program where you're going to get an opportunity to talk. So here's how this works technology-wise. We're going to pass both a mic, we'll just keep it on, and this lavalier. And this is important because this is the live piece, and this is important so we can hear today on the farm, okay? So those of us have already spoken. We don't need to speak again, but I will go ahead and give you instructions. Good? Everybody's ready? Recite? Because this is going to be interactive. We tried to plan a day where all of us as friends are going to be able to feel maybe not comfortable in the beginning, but hopefully comfortable as we move along to speak up. Speak your truth, as we always say, to feel comfortable that maybe this really isn't a safe place. Everybody says that. I don't get that part. But maybe it's a little safer place because we as a community can have a civil conversation about the way we can improve folks in health. So I know we'll all be respectful of people's opinions, and if we don't agree, that's okay. But this part of the program, I want to be able to ask you if you could do it within a minute or a minute and 10 seconds. How about that? I'm going to start with you, Destiny. How about that? Is that okay? So think about this. I think you can do it. You have the youngest brain here, I think, and it'll function quicker. You're used to being in school. So I want you to state your name, and the organization that you represent and the locations your organization serves, and what is it exactly you're going to be doing as part of the health food system. What is it that you do? Are you a food pantry? Are you a church? Or what? Just a little bit. Is everybody good with that? Thumbs up if that's good from everybody. Yahoo. Okay. Destiny, I know you're still in school, so you come up with something that sounds good. So you got to have two hands, right? Hold that. Don't cover that up and hold that. Okay. And then you're going to pass it on to Mary.
Well, hello everyone. Hey. My name is Destiny Harris. I'm a senior
Destiny.
at High School. I work with Liverpool Kershaw, and I'm an intern. And my goal is to place a club within my high school, a wellness club, and I'm working on putting a community garden, hopefully soon.
Oh goodness. Is it all good? Okay.
Well,
Right.
this is the important part.
Okay.
Now you're good.
Hello. Okay. Hey everyone, my name is Mary Reams. I'm with Live Well Kershaw. I am the Health Ambassador Coordinator for the summer. I've worked directly with the students from each high school, and Live Well Kershaw serves all of Kershaw County. My why for being here, the generation underneath me is the first generation in a very long time to not live as long as their parents. And for me, I'm here because I really want to inspire and empower our youth to take responsibility of their health and wellness, and to hopefully lower the percentage of hypokinetic diseases in our county. And I have really loved working directly with them, and without shedding too many tears, it's been really inspiring and helped me on my journey as well. So thanks, guys. Oh, you already did yours.
Good morning. My name is Sean Putnam. I'm the planner for the city of Camden. And the reason why I'm here is because basic health is so important. And if everybody in the community is not healthy, we will never reach our full potential as a city. So it's really important that we get as many people as healthy as possible so we can be the best city we can be.
So I was told that we don't need to pass this around anymore. Amazing Kirk has figured it out, so we'll just pass this mic.
Hi, I'm Robin McAlpin. I'm a volunteer at Food for the Soul, and we are a soup kitchen and a homeless shelter. The why for me being here is we serve people, and we try to serve them as healthy a food as we can. And we're also trying to teach them healthier ways to eat. We also serve the entire county. We're based in Camden, and we try to take food out. Sometimes it's hard to find those people that need the food, but we work hard to try to find them. So I'm here today to learn more about how we can push this food out to the county in a healthier way. Thank you.
Hi, I'm Connie Sheorn. I'm with Christian Community Ministries, and our job for helping others is primarily food pantry. In fact, just to make mention of the food that's on the table, that's an example of a pretty basic box that we would give someone for 1 to 2 people who live in their home for a couple of days. Our hope and prayer is that people will be able to be improved with their basic needs so that we could obviously eventually reach out for their spiritual needs as well. Thank you.
Okay, hello. My name is Amy Udi. I'm the grants writer for the City of Camden, and I'm also part of the Eat Smart, Move More Kershaw County Coalition. The projects that we've undertaken, so sort of our goal is to make the healthy choice the easy choice. And Okay, sorry about that. So our goal through Eat Smart, Move More, Kershaw County is to make the healthy choice the easy choice. And we've tried to do that through policy, systems, and environmental changes. So yeah, we would like to improve access to healthy food and make safe and provide safe places to be active. So.
Hi, I'm Joanna Craig. I used to be the director of Historic Camden and spent 26 years trying to instill and share the love of the history of our county. And since I've retired, I've had the opportunity to get to an area that really is important to me, and that is the health and the sustainability of our citizens and our children and our grandchildren. And I've had the opportunity as a volunteer to help with the clinic, the Food for the Soul, the Alpha Center, and other areas. And I feel what we're doing is so important. My attitude is if New York City and the big cities can have community gardens and be doing some of the things that they're doing, we certainly can get together here and make sure that not only the city of Camden, which I represent often, but out in the out areas, that everybody can have a chance to remember what their grandparents used to know immediately, which was how to plant a garden, how to eat well, and what to do. And I think this is a wonderful chance to us to be stewards for the future. Thank you.
I think I'm going to have to move, or I'm going to have like a Marilyn Monroe moment over here with the fan. Just saying. So my name is April Walk, and I'm the Director of Emergency Services for Kershaw Health. I'm also on the Live Well Kershaw committee, and I'm the newest member, I believe, to the Free Clinic Board. So my reason for being here is I just don't believe anybody should be hungry. That's something in America today that people should not have to deal with. And I think that this is a great group, and by working together, we can prevent anybody from being hungry. Thank you.
Hey, my name is Cam Mulliken. I'm from the Mulliken Law Firm, and I'm here actually on behalf of our nonprofit, GEA, Global Eco Adventures, which is a little misleading because we're not a travel agency. We're actually, our mission is to educate about the environment in the environment. And we've started a couple of community programs. We've done a what we call the Adventure Club, which is actually a local hiking club. And we decided to try to partner environmental education with addressing childhood obesity by getting kids out walking. And that's one of our programs. We also hope this coming year to do a educational program around a community garden. So those are our two community programs, and I'm here basically just to meet some people, and I've got lots of notes, so you'll be hearing from me to try to partner with the community garden and also with our obesity program, which is directed at middle school kids. So anyway, that's why I'm here. Thank you.
Good morning. I'm Frances Perry. I'm the current president of Mount Moriah Outreach. We operate Mount Moriah Soup Kitchen, and we're coming up on our 35th anniversary soon. We have a love for our local community and the home. I don't like a mic. You'll be all right. And the hunger here in Kershaw County. Our venture started out almost 35 years ago because of the need for a place for people to eat. There were a lot of homeless people here in the county and a lot of people that needed to be fed. What started out as one or two people has now grown to feeding approximately 120 to 130, 40 people on Mondays and Saturdays. We have a homebound delivery that we currently take meals out. My reason for being here today is because I love the community, I love people, and there's a lot of sickness issues here and health issues. And I want to learn all that I can possibly learn about helping our community.
Good morning. I'm Hessie Peterkin, and I'm with the I'm with the Mount Moriah Baptist Church Outreach Program, and I too work with the soup kitchen as well.
Good morning. My name is LaGreta Cheek. I'm actually visiting with my sister here from Arizona right now. After 43 years, retired pharmacist, and I do agree with you. We need pharmacy with an F.
Hello, I'm Lil Gaines, and I also work with the Mount Moriah Soup Kitchen, and I'm here to learn more about the way we eat. Thank you.
I'm Richard Jordan. I'm here because I love the bike ride in your area.
Well, I'm Julie Trott, and I work with many groups here actually, but my day job is Medical Services of America. I'm in the hospice division. We have 16 locations in our state, and I would love to put us out of business, because nutrition can be a big part of this. I am the community educator for our organization here in the Camden office, and I work with seniors mainly with nutrition education. I'm in all of the nursing homes, assisted livings, and we do a lot of education on nutrition, encouraging them to eat well and break a lot of habits that have been established over many, many years. I bargain with them. I try to get them to eat fried chicken only once a month. So I am here because I want to make a difference, and we want them to be around because their wisdom is so invaluable.
Good morning. I'm Tremaise Carter, the Youth Engagement Manager at Eat Smart Move More, South Carolina. I work with Kershaw County, the HYPE team here with youth engagement to get youth advocating for increased access to healthy foods and physical activity. And I also serve as staff support from Eat Smart Move More South Carolina to the Eat Smart Move More Kershaw County Coalition. And I am here to provide any support that we could provide at the state level. And I think Kershaw County rocks, so to learn from you guys as well. And if there's anything going on in the state that could help your efforts to provide that insight as well.
Good morning. My name is Marion Bennett. I serve as pastor of the historical Bethlehem Missionary Baptist Church that's located in Lugoff. I also am affiliated with several organizations, ministries here in Kershaw County. Have the privilege of working with other churches also here locally. One of the things about our congregation is that we do have a health ministry. And in fact, on the 15th of September, we will sponsor our annual health and wellness fair there at the Family Life Center of the church. A part of that health ministry is a program that is entitled Color Me Healthy. And it is a program that deals with children, whereas we attempt to do a small vegetable garden. And the children are actually to assist in that in terms of the planting, the care of the garden, the harvesting, and of course the eating. After having heard on last evening, as I had the privilege to sit with our guest speaker and others, there's much improvements on my part that we need to do in terms of bettering our gardening. So I'm excited about that this morning because I believe that there's much information that I will receive through Mr. Joyner that will help us with how to plant and how to do better. There are other things that I can say about the ministry. I think one of the things that we're all concerned about is the physical well-being along with the spiritual well-being. Because as a pastor, for one, I'm not just concerned about bodies, but I'm concerned about the holistic individual. So my prayer is that we will start moving in a better direction in order that we might see some of the kind of things that we are about this morning be improved. So I'm grateful to be here, and thanks for the invite.
Good morning. My name is Michael Conley. I'm the Director of Planning and Zoning for Kershaw County. I'm also a father. I'm a son. I'm a coach. I'm a community citizen. All those good things. What we try to do on the Kershaw County level is to transform the way our citizens think and act to improve the healthy outcomes for our entire county. We have that in our vision plan. We have that in our daily statements. It's a passion of ours. It's a true emphasis behind our county. We really do want to see our citizens to have much more healthy outcomes, to have a better life, to have better community quality of life, and all these things are webbed together. So to start from what you eat to how you eat it to how you prepare it is just the beginning. As part of that web, like I said, it's all connected. So it's very important to us, and I look forward to learning a lot of good things.
Well, my name is Caroline, and I am with the Cooking Matters program. We're in Richland County, but we do serve other counties. This is my first day, so I'm just here to learn.
I'm Rebecca Wren. I'm a registered dietitian and have been for over 20 years. Food is my life. I am preaching the gospel that y'all are preaching. 30 years later, I'm still preaching the gospel. So I retired August the 28th of last year, and on October the 17th, this friend of mine called and said, "You got to get up off the sofa because I need you. You're not done." So I went back to work. I work with SNAP Education, which is nutrition education with Cooking Matters program. We teach low-income individuals how to cook, how to shop, how to prepare, how to menu plan, how to do all of that stuff that goes into what you're talking about now. So school, we'd love to come work with y'all next summer with your project. You say you've got a club you're starting. We'll come talk to them about nutrition. Churches, we love churches because y'all got good members coming all the time. So we can do Sunday schools, we can do other groups, we can do parent groups, we've got teacher groups, we've got any group that you've got more than 5 people, I'll come. All we want to do is still spread the gospel. Thank y'all. Thank you, Rebecca. Where's the girl? Oh, I'm sorry, Brianna.
Hi, my name is Brianna, and I am a health educator with the health department. I'm also a part of the Eat Smart Move More coalitions and Live Well. And just like Amy said, I do work evolving policy systems and environmental change, and we have lots of food insecure individuals in the community, and so I'm here because I want to see us move towards more equitable health.
I'm Susan Dodato, and I'm the Development Director at the Community Medical Clinic. Although I don't directly affect food systems, one of the programs that we offer at the clinic is our Wellness Rider bus tour, which a few folks talked about. And the exciting thing about that particular community event that we've been having is it's really serving to educate the folks in Kershaw County about what our county looks like. Although we may think that we know, as a citizen, before I actually, it was my first week at work, I went on a Wellness Rider bus tour, but I really didn't know what our community looked like. But what I do know is that all the people that are here today are really working hard to improve the lives of our community and our citizens and the folks that are underserved. So it's a real privilege for me to be able to coordinate that program that we've been doing for the clinic. And a lot of the folks that are here today, some folks have been on the tour, Reverend Bennett and Sean and Joanna, and hopefully some more of you will like to attend as well. So I look forward to working with you guys in the community, and thanks y'all so much for coming.
Thank you, Susan. Okay. Isn't it just amazing the talent we have in this room, the knowledge, and we're just all like-minded because we want to live in a community of people of well-being and a culture of health. So what a wonderful basis and a foundation for today. So thank you all for sharing your story. And Francis, thank you for getting over your fear of the mic and talking anyway. So I want to move on to the next part of our program. You'll see as we go through the day, we're building. So we're learning a little bit more about what's in Kershaw County. In this part of the program, I'm going to ask Donnie Saplee, and I think Pam will join him a little bit too. And Donnie's going to give us a snapshot of what our food system looks like as we're trying to help people with hunger. Okay, Donnie?
Thanks, Susan. You have a map
on your table. David Snodgrass and I have been working on a map that will describe our food system a little bit. And as I say a little bit, as David forwarded it to me last night, he said he was sorry he couldn't make it today. This was at, I believe my email was at 12:15, a little after midnight. And he said he couldn't make it today, but he did the piece of the map. A couple of things about the map is that it's not complete. And another couple of things about it is if you look under 14 and 12, I think there's a whole lot of numbers under there, like Christian Community Ministries and a few others. And so we're going to work on that map. It's going to be online. But today you're going to help add to that map. You already have, actually, because we've been taking some notes and writing some stuff down, and we want to add to that. So I'm going to ask you to add to it a little bit. As we start, I've got 4 board members here, and I didn't realize it, but Kirk Mays, Julie Trott, Reverend Bennett, and Mike Connolly are part of my board of directors, and they truly, as Susan said, care deeply about our community. And I've heard some things today already from you, for example, about the desire to help with education. And as you read the Bible, there's no such thing as retirement, and so I'm glad you're back. It is a great day in Kershaw County for sure, and it's great because we're going to hear from a man, Reverend Joyner, who has done something. Not just talked about it, not just thought about it, but has indeed done some things. Now, I'm going to have to wonder a little bit about this thing over here, Holly. What, the blue shirt, the glasses? Okay. But you can see there's a whole lot of groups that are already doing this stuff and doing some amazing things, and together we can do even better with what we do in our community. There are food deserts for sure, and the North Central area, LiveWell has done incredible jobs of reaching out to that part of our community, but now reaching out to all of our county because indeed it's important. I'm sorry Edith Coleman's not here, Francis, because I've been working on Edith for years to join the board, so I couldn't give her a hard time today, but certainly Mount Moriah has done incredible historic things, but also still today. And so we celebrate that. So I wanted to real quickly have you add to this map, and then perhaps if you know a little something about some of these, one of the things we're going to do on this map is that you're going to be able to click on it and see what services are provided, because some of them are food pantries that maybe just do once a month. And so you might say, oh, we've got that part of the county covered, but maybe we don't. There are some that don't have education going on, and so maybe we need to do that. I know that Boys and Girls Club of Kershaw County, Brian Mays couldn't make it today, but they are looking at doing, in partnership with Our United Way, a community garden with the kids that are at the teen center. And so there are things that aren't on the map yet that need to be on the map, and that Holly can draw as well. So, so I'm putting it back to you. I know Pam's going to talk a little bit about Eat Smart, Move More and the things that are going on there, because it's important that we know what each other's doing. Christian Community Ministries does amazing things with their food pantry, but you need to know what they do. So, somebody tell me, what's not on the map yet that needs to be on the map? You probably already mentioned it today as you introduced yourself, but if it's not on here, we want to list it again. So just real quickly. Tell us a little bit more about the community garden that you're thinking about doing. Yeah?
Oh, well, it's still trying to figure it out.
Okay.
We got a piece of land behind the law firm.
Okay.
Just sitting there waiting to be plowed up and planted. We did partner with the library, who's our neighbor.
Yep.
They planted a couple years ago. They had a program, and they planted some letters and some little.
Okay.
We're just trying to expand that into a community garden.
Awesome.
Give to the community.
Great. Great. Downtown, middle of Camden. Boys and Girls Club also right in Camden.
Donnie.
Other things. Yes, ma'am.
We need to add the farmer's market.
Farmers Market, right downtown.
One of the ways that Eat Smart, Move More contributes to the farmer's market is, in fact, Amy just wrote a grant. We got $2,300 so they could have signage for their new location. So that we just received that 2 days ago. So thank you, Amy. And we've made certain that they accept SNAP debit credit. That was a huge piece a few years back, and progress there. We encourage our senior vouchers. We go out every spring when the seniors receive their vouchers. We do a walk. We've done a mayor's walk to the farmers market to encourage folks to use them. And let's see, that's our farmers market. And I want to circle back to Hype Team. I know Catherine and Live Well is now picking up, and we're joining forces with our Hype Team. And Tremise is here. That was her original job, was to get the Hype Team started, which is Healthy Young People Empowerment. And that is such a great club or organization, because I watched them come to class, begin to learn how to eat healthy. We took them on tours of the farmers market. We began to educate, but they began to see that they had a voice. They actually made a difference. I literally teared up one meeting when they began to share, and I realized that they got it. They knew they had made a difference. They decided as their first project to go to the ball fields. So we can add the ball fields because they're all throughout our county, and there was not a single healthy option. So families spent the evening out there at the ball fields with nothing healthy to eat. So they added what they called the triple play box, which contained a chicken wrap, a piece of fruit, and a bottle of water. So just exciting good things there. Our mobile nutrition center, we, through some of our grant money from Eat Smart, Move More Kershaw County, retrofitted the truck so that we could begin to take food to outlying areas. So lots of good things there. Anyone else have something to add to what else is happening in the community?
Through the Mobile Nutrition Center, one thing real quickly, John Clinton, who's on my board, who heads up the buses for Kershaw County, does other things too. And at Caney Hill Baptist Church, they found a man in Heath Springs with Rainbow Promise Ministries. And for $300, he brings 10,000 pounds of food to our Mobile Nutrition Center. So one of the things I wanted to share is that we've got stuff that we could share with you. And so if it's a pantry that needs something, if it's a church that's having an activity, as we went and shared with the schools the other day, I shared with the schools that I went to that if they've got a youth group that's wanting to do something, or in the churches as well, youth groups that are doing things, we've got food that we can give away to help them out. We do have some issues, and we're going to get to that in the future. So real quickly, I'll just say one of the issues is, what do you do when you get donated unhealthy food? Or you get food that you get donated that you don't know what to do with. So I brought a box today. It's a box of peppers. I don't know who brought us this box, but it's about full. And I heard Reverend Joyner talking about peppers, but his were, I think, hotter than these. If you've got a desire to have some peppers when you get food that's donated, I want you to get them today, because we don't have a place to do it. And so part of the reason for gathering together today is, as we get perishable foods, we got to get it out right away. And so as we build this network of folks that have outlets to give food to, then we can share with each other. And so we're excited about that. Some other ideas, some other thoughts, some other things that need to be on the map. Yes, question, Carrie. Right now, it was emailed to me this morning, or like I said, the middle of the night. It's going to be on United Way's website, but we also have a new group that's kind of formed, but it's not to duplicate or anything, but called Hungry to Help. And so I'm sure it's going to be on several of our websites to be able to do that. So as soon as David and I kind of finish this thing, I don't think it'll ever be really finished, but we're going to post it on various websites, so we'll get that out. Great question.
Save your breath. Hold on.
Maybe something to add near the schools. I can't see if it's down there, but the culinary partners training that happened with school food service staff to help improve food that's being prepared within the schools.
You got that, Holly?
I know we spoke with Misha Lawyer at the school district, and I think they're having huge deliveries today, so she wasn't able to make it, but for sure that's a huge network that we've got to be a part of, because they feed so many kids. And we do have the summer food program as well that United Way operates. There were 31 sites this year serving over 60,000 meals, And it's a great resource for, again, churches. We do Bible schools. We do, the rec department has 6 or 8 different sites throughout the community that we're able to help with. And so as you know of different churches or needs in the community, we help some apartment complexes as well. Kids need to have food during the summer just like they need Sacks of Love. That's something I don't think have talked about either. Sacks of Love helps out greatly in our schools, and they partner with a whole lot of different churches in our community to help specific school kids when they get out of school for the weekend to have a Sack of Love to go home with them.
So, Donnie.
Yes.
Sacks of Love is different from summer food programs.
Yes.
Everybody knows that?
Yes. Sacks of Love, Kershaw Baptist Association kind of coordinates it. And they weren't able to come today, but they are, of course, a huge part of what's going on in our community and partner, like I said, with numerous churches.
And then, Robin, I think you may have said earlier in your why, but could you restate the hot meals that you take out to the community? Thank you. So, Holly can make sure she gets it. Okay. Yeah, we do.
Hot meals
on Mondays. On Mondays, our center is closed for the day. We don't serve guests during the day, but we prepare hot foods and we take them out to Bethune to the Women's Club. We serve about 60 meals there because locally there they have an outreach program where the volunteers there take food to people's homes that they know that needed a hot meal. So we take out about 60 meals there. They serve them. And then on Mondays also we have a trailer and we take prepared food out and to Refuge Baptist, which is on the map, and people come to the trailer and get food, and we also take dried food, canned food to them, and we take clothing out. In fact, they are standing there waiting for us at 11:45 every Monday. And this past week, we had a little guy help deliver the food and give out food. So that was a really good sign that the community up in that area is trusting us and knowing that they can count on us. And so hopefully we're trying to match them with the local resources that we have here.
So Robin, did you say Love on the Go? Is that what that is?
Love on the Go.
All right, Love on the Go, Holly. Not hot meals, but Love on the Go.
Did we mention Meals on Wheels and the fact that the COG, Sandy Lynch's, is providing meals also?
Great. Yes, through Council on Aging, the Meals on Wheels program, great one, Joanna.
And that the COG out of Sumter is that they supply meals also to them, I think. They gave a program to council. They made the presentation.
Julie.
Well, I'll speak for Bill Taffel. He wasn't able to be with us today, but he runs a food pantry in Elgin, and it's right next door to the Piano Barn, if y'all know where the Piano Barn is, right on the main street crossing Ronnie's Ribs. So, but he is there most mornings. I believe they're not there afternoon, but most mornings 9 to 12-ish, something like that. And they do a lot of good work out there, and I know they'd be open to receiving some of the excess supplies. That would be awesome.
It's called Community of Hope Food Bank.
In addition, on Sundays, we do have several area churches that participate in providing bag meals or lunches to the homeless. And on the 5th Sundays, they also do clothing. So I don't know whether there's a particular name, and in fact, our church participates with that. We call it God's Helping Hands through our ministry at the church. That may be the name for the others as well.
It is. God's Helping Hands. And Love, Serve, Give is on the map, but I did want to mention them as well. They're doing, good job. They're doing meals on Sundays as well. 2 locations, I think. One is at Food for the Soul, and the other is Flowers Heating and Air over where the other group of homeless folks kind of hang out. So.
Donnie, if I could add one quick thing, and with all the IT and young experience that we have in this conference today, I think you could look at adding some sort of thread that all these people can get on and you guys can communicate within each other. I mean, I think that's something you guys really should do, so you can get on there and say, hey, look, I have X amount such here and here, and it just goes directly to the source and not necessarily, and not adding another layer of something on top of something for someone to, that already doesn't have time to do what they're already doing. So I think you could look into something like that.
Good. Thanks, Donnie and Pam and everybody contributing. Okay, so how about we just take 1 minute, everybody stand up, and do 10 calf raises. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Is that good, Destiny? Yay! All right, stretch. Because now Holly is continuing to color our world of Kershaw County, and I'm going to bring Katherine Johnson up here, and Holly's going to continue to add to this wonderful visual of what we have, and we're going to go ahead and look at what we go ahead, we're going to move some things. What we have for our community needs assessment and what it looks like for food insecurities. And I'm going to be her Vanna White. And the visual is going to be on this big blue sticky wall. So everybody's good? All right, you can have us. Oh yeah, and there's water in the back, so if you need something, please get up and get that. I think, okay, and does everybody know where the restrooms are? All right, so restrooms near the store. So if you look over here, I don't know what over here is, stage right. Thank you, Michael. Yes, that's good. So see that ramp? If you go up that ramp, and it's the door closest to those sheds and barns. Another one is over here to the house, the bed and breakfast. If you go up those steps and through that screen door, you'll walk through the kitchen, and on the right, there's another one. Okay, so be comfortable. And we've got some grapes and cauliflower and celery and broccoli and some of Ashley's feta cheese garlic dip, which is to die for and always runs out at the farmer's market really fast. And just so if you're still planning and like, gee, should I eat a grape now or wait for lunch? Lunch is at 11:30 after we hear the most inspiring talk from our rock star, Reverend Richard Joyner, and that will be soup and salad. So we really are having a farm-to-table lunch today. Okay, is everybody good? So Katherine Johnson, take it away, our Live Well Coalition Director.
All right, so today I'm going to be sharing, and some of you may have heard some of this information before if you're attending coalition meetings or you're just aware of our needs assessment that was conducted back in April 2017 in partnership with the Health Services District of Kershaw County and the University of South Carolina. So I have the job today to share with you the doom and gloom data, and I will take on that burden this morning. And then I'm going to let Reverend Joyner be the positivity and the light that shines through. So I will take that on. I have Susan that's going to be my Vanna White today, so I'm looking forward to how this goes. Yes. So in your packets, you can actually follow along with the slides. We're not doing a PowerPoint today. We're just going old school with y'all. So the objectives of this portion with that so that we see the full picture of what's going on. So to start us off, I'm going to give a brief overview about social determinants of health. All of those conditions in the environment that really shape an individual's health outcomes. So it may not necessarily be the fact that you can reach a doctor, you can get in to see the doctor, you can get an appointment, you're not having to wait, and that you can afford a doctor. It has a lot to do with those social and economic factors, which I think most of us in this room today might be aware of, but some may not. So I think it's important that we talk about this. But the Robert Wood Johnson Foundation has a county health rankings model, and if you're following along with the slides, you can see that. And it breaks it down into what percentage of which piece is impacting an individual's health outcomes the most. So I'm going to have Vanna go ahead and put those up there for us. So we have I have a short Vanna. I might need to enlist. I'll go with someone taller next time. All right, so we have health behaviors, we have clinical care, we've got social and economic factors, and then we've got the physical environment, and all of those pieces are coming together to influence an individual's health. So I would do a pop quiz at this point, but since you have my slide deck, you already have the answers. All right, so what percentage of health behaviors? All right, 30%. Pop it up there. 30% of an individual's health. So what's most surprising to me is when Vanna puts up the 20% for clinical care, the fact that being able to reach and access a doctor is only 20% of an individual's health outcomes. Very surprising. So the majority of your outcomes are coming from. And then the physical environment, we're coming in at 10%. So a combined 70% of our health outcomes have to do with health behaviors and social and economic factors. So I'm going to let that sit with you guys for a little bit. And to provide a little bit of perspective about where Kershaw County falls in county health rankings, we are coming in out of 46 counties in South Carolina. We are number 10 in health outcomes and number 16, ranked number 16 out of 46 in overall health. So that's where we're falling. Was it 4 years ago we were at number 10? So we've gone down. So, all right. Okay, so now we're going to go into a little bit of overview about our county. So how many people, how many residents do we have living in Kershaw County? If you're following along with the slides, you've already got the answer. All right, we're about 63,000 folks and 2 to 3% growth rate annually. So what state is Kershaw County relative to in size? Some of you might know this, some may not. What state? Okay, I'm having to read lips because I'm like, oh. Okay, it's Rhode Island. So I don't think we're the same culturally, but we're about the same in size geographically. So Kershaw County is about the size of Rhode Island. Some of our demographics for Kershaw County were at about 70% Caucasian and 30% minorities, which we have 24% African American and around 4% Hispanic. And our fastest growing age group happens to be the 20 to 64-year-old range. So just a little fun facts for you guys. I do want to cover our income levels. So median household income, guys, we're coming in at around $43,000 annually, which is a little bit above South Carolina and definitely below comparing to the rest of the United States. So that's where we're falling. What's interesting for poverty and unemployment rate, we are at 17% of our county is living in poverty. 17%. Our unemployment rate is a little bit below that of South Carolina, and that's coming in at 6.3%. South Carolina is around 7%. All right. So we're already starting to see where some of these things we're talking about are fitting into those 30%, those 40%. That income, educational level we'll talk on briefly, but some of these pieces are already fitting into and giving us those reasons why we're number 10, why we're number 16 out of 46 in South Carolina. So some disparities, we'll dig a little deeper. So North Camden median income around $65,000 annually. Our lowest incomes can be found in and around South Camden at a median income of around $40,000 a year. Our highest is in Southwest Lugoff, around $87,000 a year. So there's a huge disparity there in income levels. So our bottom 4 income areas in Kershaw County, 4 is Mount Pisgah area, number 3, Cassett and Westville, 2, Bethune, and number 1 lowest income area in Kershaw County is South Camden. All right, so moving into education and poverty, and here is where I think about all these maps that we're about to see, and if you overlaid all of them, you overlaid educational attainment, poverty, and the income level, they're so comparable. And you have a better understanding of why the food deserts exist there. All of this information just comes together and complements each other. So areas outside Camden, Elgin, and Lugoff have high rates of poverty, which we're seeing here from the data, as well as low educational attainment, which has been centered around Westville and Mount Pisgah area. Yeah. So here in the following slide, we have our food deserts. And if you take a look at the blue dots, you can see around Camden, Elgin, and Lugoff, those are where the majority of our grocery stores exist. Now, if you look at the orange shaded parts, those are where our food deserts are, and you don't see any blue dots hanging out around those areas. So, indicating our food deserts. So we've talked about a couple of different things already. We've talked about our population, poverty rates, unemployment rates, where our lowest income levels are. And we're beginning to see that bigger picture of all those pieces that come together to influence somebody's health. So if you look at the image with the little stick figure, it says your longevity and health are more determined by your zip code than they are by your genetic code. So anybody know how many zip codes we have in Kershaw County? 13 zip codes. So it seems a little unfair for one zip code to live longer than another, right? That doesn't seem fair. For all of that to predict how long you're going to live, what your health outcomes are going to look like. But all of this data is showing us that these disparities do exist in our county. So more doom and gloom data, guys. We're going into our top 3 causes of death in Kershaw County. So we got a big fancy word here, malignant neoplasms. It's cancer. So our top 3 causes of death, number 1, cancer. Number 2, diseases of the heart, cardiovascular disease. And number 3 happen to be accidents. And unfortunately, the leading cause of death for people in Kershaw County under the age of 24 are accidents. Yeah.
We have more accidents. That's one of the major reasons of why we've dropped in our county rankings.
So if you see that next slide and you see the baby, and it was that meme that was like, yeah, hashtag winning. Winning is good, right? Well, not here. So out of 46 counties in South Carolina, we're ranked number 2 for highest prevalence of diabetes, number 11 for hypertension, and number 8 for obesity. So that's where we're falling, guys. And this information is coming out of the South Carolina Department of Health and Environmental Control. So DHEC has provided us with this information so that we can know where we're falling, where we need to put all of our resources and energy. All right. So next up, we've got some maps for everyone to view and look at. The first one is chronic disease burden in Kershaw County. Pretty colorful here, and we can see that the majority of chronic diseases are up in that northeastern portion of our county. Bethune, Cassett, I see town of Kershaw highlighted, and also Ridgeway. So that's where a lot of our chronic disease lies. Now, if we break that down into the next couple of slides, we will view hypertension, diabetes, and cardiovascular disease, a lot of those issues that we are winning at, unfortunately. So hypertension, we see that situated heavily in Bethune and Ridgeway. Diabetes, Cassett, Rembert, and Ridgeway. And these are all broken down by zip codes, and you'll see that in the chart. For cardiovascular disease, there's almost no point in me naming the towns because we don't really have a lot of disparity there when it comes to cardiovascular disease. It appears that across the board we are enjoying fried chicken in Kershaw County. So unfortunately, no disparities there. So high rates of cardiovascular disease. There is equity in fried chicken, as Susan is saying. So here we will hear a little bit about what our community told us when we went out into the community. We conducted focus groups. We did a community survey where we had nearly 1,200 responses from Kershaw County residents. So we've discussed the data that comes from DHEC and the census and things like that. But now I think is a really interesting point in the conversation where we hear from the residents themselves. So when we asked residents, we did a community survey, we got that information back. We heard that the top 3 health concerns from Kershaw County residents were related to obesity, substance abuse, and hypertension. So it wasn't just enough to ask, okay, what do you think the issues are? We wanted to dive a little bit deeper and say, okay, well, why do you think that is? What is the root cause of obesity? Where is it coming from? How is it coming about? So the root causes, the top 3 root causes for these issues: insurance. It was a personal choice issue, which is huge, and then a lack of healthy foods in the area. So it changed a little bit from the community survey that we conducted to the focus groups that we're able to have. Of course, when you're conducting a focus group, you're able to get a little bit more information because you can engage somebody in a conversation here and now and get more information on the why and the root cause from them as opposed to conducting a community survey. But the root causes of the health problems from the focus groups were, number one, the perception of Kershaw County residents were built environment, increasing cost of living, and increasing cost of health care. And they identified the root causes to be a lack of available community resources, cost of health care, and increasing cost of living. So it's not to say that some of these resources don't exist in our community. It's an entirely different issue in itself that people aren't aware that they exist. So I know I've been kind of talking at you guys a little bit, so here's where I want some participation, and I'll walk around with the mic. But here's where we have some of the direct quotes that were pulled from the focus group transcripts. And it's broken down into different themes relating to this day. We're here to gather today to talk about the way we eat. So some of those focus groups, I have one here for diabetes. So I'm gonna call on Mary Reams to read that quote for us.
My niece is only 5 and has juvenile diabetes, only because her parents don't take the time to feed her the proper things. They just give them a burger from McDonald's and think the kid is fine.
Thank you, Mary Reams. So let's hear a little bit about obesity. So Amy, would you mind reading this for me?
It's probably a good combination of we're more sedentary. If you're working longer hours and running from one job to another, you're picking up something fast on the way, so you're not eating. You're eating either junk food or maybe some sort of quick cold cut sandwich to take with you to eat. So that's all salt.
All right, one more about obesity. Can I pick on you, Joanna?
You know, it's really also what we're accustomed to. There is a lot of good comfort food in the South, and God Almighty, salt is the main staple, and salt is the root of many evils. You've got to know weight gain from the sodium. You've got, weight gain from the sodium, from the water retention, from all that kind of stuff.
Thank you, Joanna. So here, we're starting to see some of those themes come out. And let's hear from this table on the lack of knowledge of healthy lifestyles. Oh, she's not making eye contact with me.
Lack of knowledge on healthy lifestyles. What's available? You say, well, I know you have to cook the fried chicken because my mother taught me how to cook fried chicken when I was 7.
If we just brought kale and carrots and all this healthy food, do people know how to cook healthy food, or would they need some classes or some lessons?
It also begins by being able to get the types of food that they need. To help control, eat healthy fruits and vegetables. Things like that to help them maintain their diets. Produce and some of your whole grain foods are always seemingly more expensive.
I love the way you read that. All right, I'm coming around to the back. So let's hear about potential programs for a healthy lifestyle that folks in our focus groups identified. I'm going to pick on you, Pastor Bennett.
It costs less to take a family to a restaurant to eat than it would to go buy all the ingredients in the store. That's wasting money that could be going towards a bill.
And Tremaine, I'm going to pick on you for the last quote.
Right. Well, as far as I'm concerned, I'm about $100 over getting any help at all.
So here we see some of those things that people are identifying as issues for them, and I'm trying to find my way back through this maze to the front. So they already were talking about the really root cause of issues. As far as I'm concerned, I'm about $100 over even qualifying for any type of help, or I want to put my money towards a bill because that's the day-to-day and that's what I have to take care of. Not thinking long-term health-wise, but I've got to meet my needs today. So when we're talking about helping people and making sure our food systems are coordinated and we're really caring for the individual themselves, these are things that we need to think about. That a problem that we sitting around these tables might identify as an issue is a complete non-issue or a non-thought to these individuals that we're working with every day. So when we move to the community survey results, I want to highlight some of the number one health concerns that came out of the survey themselves. So our number one came in at being overweight and obese. That was an overwhelming 54% of responses. And then followed by number 2, the reason it being difficult to be healthy is a perceived lack of affordable healthy foods. Now, the top reasons people identified as reasons that are preventing them from accessing or eating healthy food is number 1, they're eating fast food regularly. 2, it's too expensive. And 3, they don't know how to cook at home or they're not cooking at home due to their schedules. So then we wanted to know, okay, you've told us all these problems. You told us the root cause. You told us what's the issue. What is preventing you from living a healthier lifestyle? So what do you need? What is needed for you to become healthier, live a healthier lifestyle? What do you need? So the theme across the board was number 1 and 2, access. access to affordable health care, number 1. Number 2, access to healthy and affordable foods. And number 3, good jobs, healthy economy was what was needed, what was identified by residents as what they needed to succeed. Now, our takeaways from the data, we looked at data from DHEC, we paired that with the focus groups, we compared that to the community survey that we did where 1,200 individuals filled it out, completed it, told us what they needed. The overarching themes from what was told to us was that the problems of Kershaw County are not limited to one portion of or area. We saw that with cardiovascular disease. Number 2, there's a perceived lack of built environment in Kershaw County. Number 3, the cost of living is increasing faster than the living wage. So built environment. Built environment is having access to safe sidewalks, lighting, safe trails to walk on, crosswalks, things that make it easier to be active in your community. And I know I have some experts in here on built environment, so if I've missed anything, let me know. Sean, do you want to? Good? Okay. Right. If you can cross the street safely, things in your environment that would encourage you to be healthy. Number 4, Kershaw County's population desires to become healthy, but doesn't quite know how to. So there's kind of this hunger for knowledge out there that exists. So here's where, we've presented this data. We're going to sit with it. We're going to ruminate on it. And I'm going to let Reverend Joyner bring us back up because we might be feeling a little low right now. We got all these problems. We heard all this cardiovascular disease and chronic disease burden that's just so widespread. But before I wrap it up, I just want to hit on 3 different types of problems that we have dealt with or are dealing with currently. So there are simple problems, there are complicated problems, and then there are complex problems. A simple problem might be that, say I forgot that tomorrow is my mom's birthday, so I'm going to run out to the grocery store, I'm going to grab a cake mix really quick, go back, follow the recipe step by step, have the cake baked, she doesn't know that I forgot her birthday. Problem solved. It was relatively simple. So if you look on your slides, you'll see a rocket ship under complicated. Well, going to the moons, you literally do have to be a rocket scientist to get to the moon. So that's complicated. That's a complicated problem. But there are people out there that are trained to do it, and it's not me. Complex problems are where it's what we're sitting in this room today trying to work through. I like to think about, so if you're in a factory, you're overlooking this process happening. Say you're in a broom factory. You start at this point, you've got all these inputs, your raw materials, it's going through this process, and out pops a broom at the end. When we're here today, under this tent, under this garage port, talking about these issues, we don't know if we're going to get a broom at the end of this day. We don't have we're not even sure if we've got all the puzzle pieces in the room. We don't know what our raw materials are, what's going to fit together. So we've got a lot of variables that we're working with, and we're trusting and hoping that our intended goal, it may not look like what we think it is or what we envision. We might not leave here with a broom today. So I just want to highlight those problems, different types, and how they're so different from each other, but also the beauty of coming together today to begin to work on this together. I'll leave us with this quote, another quote from the focus groups that a Kershaw County resident said. "We have become very lazy about our health. It does not matter how educated our children are if they only know that supper is a Happy Meal or pizza. We have also wanted to make everything a quick fix. A healthy lifestyle is taught from birth. Healthy choices need to be taught and modeled for children to learn them. Health is a lifelong process." So
I've shared the data. We might be feeling low, but I trust that we will be brought back up with Reverend Joyner. Thank you.
Okay, so how y'all feeling? Did you learn some things this morning? Thinking about some things? Great. So it is my absolute pleasure now to introduce our guest speaker today. And usually, people who know me, I don't read from paper or I can just talk off the top of my head, but I want to make sure I get this right because there's some amazing quotes in here from if you looked at the link that we included in the invitation. But before I do that, I was tasked to introduce Reverend Richard Joyner in a compelling way. So I'm going to ask you all to help me use your voices this morning because I want him to feel welcome. So we are going to be able to say his hometown correctly. I want you to repeat after me. Reverend Joyner is from Canita. Can we say Canita? One more time. Canita. So now I learned this from Jalen Busey when we went to the All-America City, and he said, when I say Kershaw, you say county. So I'm going to do this. When I say Reverend Joyner, you say Canita, and we're going to do that twice, right? So with your loudest voice, we are going to rev up this, and then I'm going to introduce him, and he's going to come up here and take us to church on the farm. We ready? Is that good? Reverend Joyner. Oh, louder. Reverend Joyner. So we will never forget. He is from where? Thank you, everybody. All righty. So let me go ahead and give you some absolutely descriptive words about this rock star from Canita, North Carolina that we're going to have. And they describe him as a minister sowed seeds of hope in a food system. So Catherine wasn't too far wrong from when she said, Reverend Joyner is going to give us hope because he has sowed some seeds already. We're not saying it's easy, it's complex, but there is hope, right? And it said that Reverend Richard Joyner got mad. Then he got a trowel. Everybody knows what a trowel is? Right? Sick and tired of seeing his congregation suffer from poor nutrition, the North Carolina minister sowed seeds of hope in a food desert. And I love this because after eating dinner with him last night and I'm sorry you all couldn't be there, but we had an amazing conversation. So I love this part in here when he talks about that Reverend Joyner thunders from the pulpit. All right, hang on a second. Oh. And when you thunder from the pulpit in the stereotypical Baptist way, do we all know what that is? In the Baptist fashion. All right, but heed his words. And here is what he ponders this passage from one rousing sermon. So I want to bring this to you today because I think it's very poignant. Friendship is deeper than what you do. Friendship is deeper than the story told. Friendship. That's how we are going to transform this community. Not by being churches, not by being preachers. And then it said he had a dramatic pause. We are going to transform it by being friends. So, you end with, can I get a witness? Can I get Reverend Joyner up here?
Thank you. So good to be in Kershaw County and Cameron. Thank you so much. Had a good bike ride this morning. You got friendly drivers out there. It was real kind. I am excited about being here with you. Once you connect the cone toe, it's hard to get rid of us. We keep coming back. And so I'm excited about all the good news I've heard here today. And and how you have just laid this picture out, and how you are galvanizing your energy together. And I'm glad that we are not inside a building. Because these challenges as opportunities do not come to us because of a building. We can't work them out in air conditioning. How many know we got to work them out with the gnats being used as protein? So if you eat them, you're just going to get more energy. All right. So after a while, they said, don't go over there. They eat all the gnats. But I'm excited. I bring you greetings from Canada, excited about what's happening there and here. Bring you greetings from Jan Zickerman, the Duke Endowment Model Food Systems. We're looking at the Rocky Mountain area and Edgecombe County, the eastern part of North Carolina. When I look at your statistics there and look at the things that that faces us, the motto of the buffalo is not to run from the storm, but to run into the eye of the storm. And how many know when we run into the eye of the storm together, we change the direction of the storm, right? And how many know it's time to run into the eye of the storm, right? And so I'm excited about being here. Just 14 years ago, I assumed the leadership of Canida Chapel Missionary Baptist Church. And you said Canida, everybody said Conto. They know it's Conto all day long. C-O-N-E-T-O-E is Conto all day long. I thank you for being nice. Okay, well, good. They'll get me when I get back. But we were facing some of the same challenges, but it wasn't that we learned it because it was on a statistics or paper. We learned it because we were burying people that was our family, was friends of ours. We were burying our hope, our future, and we were burying our history. And so I assumed the leadership of this church by a gracious man named Pastor T.R. Vines. He had been at this church for 50 years, and I was just there to help him out. He was 92 years old. If you ever get a chance to help a 92-year-old person do something other than take a vacation, it's a setup. Okay? I wasn't smart enough to figure it out. He was 92 years old. I came on to help him out. He called me one morning and said, I found a pastor for the church. I was happy. I said, man, I'm ready to leave. I want to go to the beach on Sunday. I want to relax, I was a full-time chaplain at the hospital. I was one of those preachers that really didn't want to do all that church stuff. I didn't want to be dealing with deacons, as the devilish deacons and tricky trustees. I didn't want to be dealing with that. I just want to give a little something and rest a whole lot. He showed up Sunday morning, white suit, and Pastor Burnett, he came and I kept looking for somebody that looked like a pastor. Everybody I saw was the people that been showing up every Sunday. I said, maybe ordain one of them. That would be good. And he pointed to me and said, you're the new pastor of the church. And I literally said to him, in the Baptist church, we vote on everything. I said, we haven't had a vote. He said, I've been here 52 years. I'm 96 years old. I can do what I want to do. You're the pastor. So that was it, Pastor Burnett. And it started that year. And those statistics that we're talking about right now, I didn't learn it from the state, giving the report. I didn't learn it from the county. I learned those statistics by watching people bury their families and was hopeless, couldn't do anything about it. And we had 32 funerals in 1 year, and mostly black males. And our county numbers is just the opposite of yours. We're a majority Afro-American, and we would experience this rate of high blood pressure, diabetes, obesity, eating chicken, honey bun cakes, all those things, coconut cake and pineapple cake with the sugar running out of it, and sweet tea if you didn't get enough. And so all of those things that we were facing, and we literally, had normalized. Anybody sees about normalized things that you just get used to being sick? You just get used to people dying. You just get used to obesity, and we normalized it and the trauma of it. And so I can tell you, before that time, you couldn't have gotten me on a farm no matter how much you paid me. I didn't want to have anything to do with farming. I made up my mind because of the racism and the different things I experienced on the farm growing up and sharecropping. Anybody ever sharecrop before? You only share the crop in the fields. You don't share it when it's time to get the money, right? That's what you call sharecrop, right? And so I made up my mind it had nothing else to do with the farm, and I wasn't going to have anything to do with it. And so we were in a food desert, and I never thought about a food desert. They said, one of the problems, Jonah, you live in a food desert. I said, what do you mean a food desert? So you don't have access to locally affordable, healthy grown food. We're in a food desert. Talking to other friends, Dr. Cunningham, a good friend of mine, said to me, Jonah, everything that you're dealing with could be dealt with through nutrition and mobility. So you got to start getting people access to healthy food. Where the average income in Canita is $21,000 per household. So we weren't about to buy nothing, okay? We wasn't buying anything. And so, have anybody ever been just frustrated? I mean, just literally frustrated that like you just say, I am so damn frustrated. I'll take any answer, right? Something has to change, and so we're having these funerals, and when you have so many funerals, that the repast become the problem. That you have so many funerals that the church decide we don't want to feed the people no more because it's getting too costly. Isn't it amazing that we wasn't thinking about stopping the funerals? We were more thinking about how we stop feeding them. And so we were just facing this process, and my mom always told me, Richard, you're a preacher, you ought to learn how to pray, and I said, well, Mom, don't be so hard on me. So one day I was coming back to Canita. I'm a chaplain at Nash General. I pulled on the side of the road, took Mom's advice, and decided I would pray. 98 degrees in this kind of heat, rolled the window down and said, maybe God going to speak something to me. I prayed, and I literally heard the answer say, open your eyes and look around you. I really thought I was going to see somebody that had won the lottery and had a bunch of money was going to pass to me, something great was going to happen. And I opened my eyes, and make a guess what I saw. Farmland. As far as you could see, nothing but vacant farmland, fields. Have anybody had prayed and, you seem like God playing with you? And I literally said, God, I'm serious. I know you got a sense of humor, but this isn't no time to play around. And finally I said, is there anybody else I can talk to? Evidently I'm talking to an angel or somebody. So from that process, 14 years ago, we decided to do our first agriculture, agribusiness summer camp. And the goal of the summer camp was that we would use this opportunity that I've learned from Norris Tolson, who was a good friend of mine, that introduced me to a biotechnology center that we're talking about how we train youth in agriculture and agribusiness. And so we decided we would do it, and that we would teach them math, science, and reading, technology, and that we would build social skills, because our process was that we want to work on human development, human development, and we knew that the challenges that were facing us, no grant were going to get us through it, right? So we said we would apply for a grant, but you're not going to get grants long enough to change this process, right? So we were looking at human development and sustainability. How many know anything you human develop, you got to figure out how to sustain it, right? How many ever had a good idea that got funded and the funding left and the idea left too? Right? And so we had to look at how are we going to make this literally sustainable. So we came up with the idea of the farm. And believe it or not, I didn't believe in it. You know, deep down inside, I was trying my best to get off the hook. You know, and I felt like that, you know, maybe if don't nobody show up, then I won't show up. So we said it, we put it out there, and we kept announcing it over the pulpit. And the day that the camp started, I told my deacons, I said, look, you guys show up, and if nobody show up, lock the church and go home, you know. Nobody gonna show up. Who gonna show up to do farm work? Right? What child do you know in their right mind gonna show up to work on the farm, to do their math, do their reading, feed themselves, and learn social skills and learn all of this stuff? Who can show up? Nobody can show up. So we opened the church up, and I went to work, and at work I got a call at work saying that your deacon want to talk to you. I said, my deacon want to talk to me? I'm at work. Just, you know, shut the church down and go home. So I go to the phone. I said, look, man, what's up? You know, just shut the church down and go home. Nobody showed up. He said, no. There's 100 children in this church, and none of them are church children. They're running through the church. Some of them practicing preaching. They're on the piano. They're on the drums, and they're slamming the doors, and they're everywhere. And they said, parents still dropping them off. We don't know who they are, you know. And he said, you need to get over here. And I did. I got there, and I got out of the car, and they were like, Reverend Jonah, hey, can we go to the farm? I said, what farm? We did not plan for this camp. We had no farm, because I didn't think no one would show up. And that was the year that we started this process. And we had 100 kids that stuck with us, and every single day they got to this camp at 5:30 in the morning. They did calisthenics because we worked on obesity. We were doing calisthenics, push-ups, sit-ups, jumping jacks, leg ups, and back then we started at 4 years old. The 4-year-olds were doing walking. They would do a half-a-mile walk, 4 to 6, and then up and above we're doing a mile. We got to the older kids were doing a 3-mile run. We had that summer we had youth that lost over 30 pounds just in that camp, just really lost weight. It was a free summer camp. It was a really free summer camp. We, you know, and we make a guess what one of the biggest challenges was to us. First of all, the church letting us stay in the church, because we wasn't used to having the church open from Monday to Saturday. And make a guess what? We were tearing stuff up, right? And they wasn't all church children, right? And so, and we didn't have enough volunteers because we weren't paying nobody. You know, I forgot to raise money, you know. I forgot to write a grant. I forgot to do all that stuff. But how many know that God will supply, right? And so I went to all my Baptist friends. I asked my Baptist friends, would they help me? And they had heard about what I did. They said, Jonah, you crazy. Ain't no way I'm going to no farm. And I said, what? I said, come on, man, let's do it. No way. No, you do it. I went to all of my good Christian Baptist friends, and they would not help me. They said, call me when you do the revival. Call me when you have the choir anniversary. Call me when you do the entertainment stuff, but this stuff we don't do. I went to a good friend of mine, Minister Melvin Muhammad, and I said, look, man, when I come to a Muslim, you know I'm deep in trouble. I need your help. And this is a turning part that really brought us here. He said, we'll come and help you. That was a 12-week summer camp. I did the exercise in the morning. He did the remediation with education, other volunteers, helping these children with reading, writing, doing all this stuff, doing backpack buddies where they were cooking their own food that were raised in the garden, reducing these health components. And for 12 weeks it worked. And taking trips. And, you know, we had this 2 vans. They were hoopties. Anybody know what a hoopty is, don't you? You hope that it leave and you hope that it come back. And he would load these kids up on these vans, and he would call me and say, we're headed out to take the kids on a field trip. Do you want me to stop by? I said, no, please don't. I don't want to see it. It's illegal. I know it's illegal. There's no way you can get those many kids on 3 vans. I'm going to pray till you come back. And so 12 weeks went by. We finished. Our deacon told me, he said, you know, he said, this minister is smarter than you. So you thought of the idea, you couldn't make it work. He says that, I want this guy to come to church. And I said, oh, no, he can't come to church. And he said, no, I talked to him. We're going to close out the summer camp at church. And I said, he can't come to church. Because my deacon didn't know he was Muslim. And I wasn't about to tell the Baptist that I let a deacon and another Muslim in the church. You know. They kick you out for less than that. And so Minister Melvin Muhammad came to church that Sunday morning, and we almost made it through the whole service, and deacon stopped the service. So I want the minister to say something. So he's done a fabulous job. He's really done more than our pastor could do. Our pastor had left it to our pastor. These kids would tow the church up. But this guy helped us out. So minister come and say something. Make a guess the first thing he said when he walked up there. In the name of Allah, the Beneficent, and my deacon said a Muslim in the church. Almost lost it. But what it proved to me, proved to all of us, that God can use all people, right? That we do not get a choice to tell God who God can use for the human development and the sustainability of his people, right? And so I said that then I had to apologize because I was limiting God. How many know if you really want God to change this, how many know you got to get ready to deal with some stuff that you haven't been dealing with? If you really, really want this to change, see, if you don't want this, if you want it to change, the first change, you better get ready because God can change something else, right? Right? God can change something in us. And so he did do that. And I just want to fast forward. This 14 years later that these kids, the youth is still working. And the majority on our board of directors is still our youth because our youth make the good decisions, right? Their partnership with Hatteras Island. We just got back from California, working with youth in California. Their goal is that how we're going to work with chronic disease prevention and how we're going to do it in a sustainable, measurable outcome. And so we ran our zip codes. We reduced the use of the emergency room for primary health care. We reduced the 30-day readmits. We got a 98% graduation rate. And this year, since that time, they own a 25-acre farm with enough equipment to do 100 acres. They run 21 other small community gardens that they provide all the plants for, and that they are getting youth processed. This year, they decided that they would feed themselves from the garden. They did not take the summer feeding program. They decided that we would train students in culinary skills. So that we were going to work on chronic disease by what we grow in the garden. See, and we was up at 5 in the morning. So let me tell you something. When you get ready to fail, when you're really, really, really serious, about this process. That's all right. See that? All of those things, they're gone now. We're going up. Right? So all of those things are holding us back. Now they down. We're over here now. Let me move over here. Yeah. Come on, you can clap for that. We just moved to another level. God just brought it down. It ain't going nowhere. Yeah, we just lifted it out. So when you get ready to really get serious about this, you get ready for some changes, right? And the changes start with you. I'm up every morning at 3:30 in the morning to get to these farms, get to the farm, start it up for the youth. And you know, and the first thing I tell people, when you really want to make a change, don't say what you won't do. Just say, by any means necessary, we're going to change these outcomes, right? By any means. If it means getting up at 3:30 in the morning, I'm up, right? If it means exercising and changing some of my ways, right, I'm up. If it means me as a Baptist partnership with a Muslim, a Jehovah's Witness, a Baha'i faith, of anybody else to do human development, and we'll figure out who bless the food or who don't bless the food. We want change. Anybody want to change? Come on. Anybody tired of just being stuck up? You got to go across those fences, and you got to get ready to make the change. The kids did this. They fed 60 students a day. They prepared the meals every single day. They did 100 CSA boxes every week. That how they paid for their programs. See, grants make us fight each other sometimes, because we compete with each other, but we got to find a way. We got to find a product. We got to find a product that will give us the human development too. So our kids are building their social skills. Their grandfathers and grandmothers and parents are out there working with them in the garden. To this morning, I called them. They're starting their fall garden. They put out 5,000 collard plants today, and those collard plants are already sold. And that's the kind of process that we got to work on. The school system, Dr. Bridges, had out to Dr. Bridges. She buying her vegetables from her school system from this garden. So the kids got their vegetables in the school system. That was a goal of theirs. How do we get the food in the school system and get the money back to the community? And so they found it out. The hospital buying 100 CSA boxes from these gardens, and that money come back to the community. You know, and we're providing fresh vegetable boxes for everybody that get discharged from the hospital with the vegetables to meet those medical needs that they have. How many know you can eat your way into health just like you eat your way into poor health, right? Pastor, we changed it at the church. No more fried chicken, no more sweet teas, no more honey bun cakes. And we talk at the funeral. We share at the funeral what killed this person other than God. Sometimes God ain't got no other choice based on how we live. And so we got to be honest with ourselves. We got to be literally honest. Look, I'm not going to shout you out of this. I'm not going to preach you out of this. I'm not going to pray you out of this. We got to build a relationship, and we got to work our ass out of this. That's the only way it's going to happen. And so I just stopped by to say to you this morning that we want a partnership. We want a relationship. And so we do have to deal with the racial process that food, faith had gotten us to. And if we don't deal with that, I had to deal with my own process of what it really means to grow up all of my life watching a white man steal from my father every single year for 17 years. I still had some hatred in me from that, right? And if I'm really going to get along with my white brothers, then I got to say that to them, that we got something we got to deal with. How do you take your privilege that you got from that and help me with my non-privilege that I didn't get from that? And how do we go forward, right? And we got to be honest. Parent, because when our children come to us and raise these issues, we got to be honest. So we are really excited about what we're doing. I'm excited about being on this great farm, right? Isn't this a great farm? Come on, give it up. And so I'm excited. I'm excited. Our goal is to, and we're doing our food banks. Our goal is to take the can off the tables and put fresh food up there. And people know how to cook it. And so I'm excited about being here. I'm excited about being alive. But every day we wake up, there's a child working up in an environment that they don't have food. They don't have the social environment that they need. And it's our responsibility to make sure they have it, right? And so I'm excited about being here. I'm excited about coming back. And we can go to the next level. And so I just want to tell you this story, and I'm going to shut it down. You know, we were dealing with a lot of deaths. And there was one student that, real close to me, her, Tashiana, she became a beekeeper, and I brought you some honey here for my kids. And so she told her story about why she was in the program. And her father died from diabetes. And, you know, how many ever been a part of something and you really wasn't committed to it? You were just there. And she told her story and wrecked my life because I really wasn't committed. And she told the story of how her father and her family became a part of this because they believed that changing his dietary would extend his life. And when he died early on in his 30s, and she was still a child, 13 years old, and that she decided, didn't know whether she would get out of the program or stay in it. And when she told her story that she was going to stick with the program because her mother, her brother, and her sister, none of them were going to die because of diabetes, because they were going to change their life, change the way they live, and they were going to outlive that disease. And she made that commitment at 13 years old. It changed my life because I finally realized I was not as committed as that child was committed. I was committed, but not like that. And I want to challenge you. I want to leave you, challenge you. If the only reason you're committed to what you're doing is because your paycheck or because it's easy, then you are not committed. If you're committed that if the paycheck go away and all the fame go away, you won't go away. Our children, our community need to know, come hell or high water, we ain't going nowhere. We're here, and we're going to defeat these diseases. We're going to win this battle, and we're going to change those numbers. Right? Thank you.
Thank you, Reverend Joyner. So you packed a lot in just a little bit of time. So we have a little bit of time left. So can I indulge this? Can we take 5 minutes of quiet time and talk amongst your table, and each table could ask you a question? No. So just in the next 5 minutes, think about what you've heard this morning, what Reverend Joyner has said, and you all vote amongst yourselves, one question a table, and then we'll start lunch. Is that good? All right, thank you. Holy cow. The wall of Jericho just fell.
I'm going to just clean it up and take out because we're not using it.
No, I'll do it. And then you're good for all afternoon. Joiner or comment? No questions, no. You did? You want to share what you heard or said? Or Hassie can speak for you.
First of all, I'm not a talker, I'm a worker. Second of all, standing here, we just found out that my family, the Ellis family, which I originated from in North Carolina, and Reverend Joyner knows my family. So we were sitting here just discussing how the origination on the farms has come back full circle, and that there is so much to gain. But the main thing is that there has to be commitment, and that we all have to sit down and bring the problems and the questions to the table before we can do anything of benefit to everything, and especially our children. We're at a point in our lives where we can only go so far. We're closer to the ending for the older ones than the beginning. But we have to teach our children, and we have to teach them the right way. Not the way we think things ought to be taught, but the right way. We all have to live here together, and we can help each other.
Thank you, Francis, for sharing. So how about, everybody? So how about this table right here? Who would like to speak and ask Reverend Joyner a question?
Reverend Joyner, I would just like to say that I think the most impressive piece of your program is how you work on human development. That your goal is to make each individual the very best person they can be. And I just salute that. That really touches my heart, and it changes the way I see everything. So I just applaud you and your program. But our question, we really would love to know specifics about the farm piece. So we know that like the 100 children got there, and that you did the calisthenics, you did some educational pieces, but how did you actually begin? Did someone donate some land? Did you have a greenhouse for seedlings? Did you, that first year, and you have 100 kids, how did the farm piece come into it?
Believe it or not, it was a lady that said, she was in D.C., and she said, if you keep the grass down, you can do whatever you want to with it. And so that's how we got the first half an acre of land that we agreed with her that we would do that. And all of us took money out of our pockets to make it work. We didn't have any grants. We had passion, we had fire in our guts, and we had no grants. The grants came later. But we started with no grants, 0 grant, and we got to do it. And after that, the resources followed.
Thank you. Okay, Mike, someone in your section, table.
Our question has to do with the school piece, where you're able to sell the produce to schools and it's self-sustaining that way. How difficult was it for you to sell that due to the fact that fresh food is more labor intensive? And we understand that, we know that, but it's not as easy. And so for them to be taking on more steps in their daily process that maybe they're already pressed, how did you get that across?
We were sitting in a meeting one day with not the superintendent, we had him, other superintendent, and we partnership with Hatteras Island, and the goal of the youth was to get the fish in the school system in Hatteras Island and the vegetables in the school system of Edgecombe. And our superintendent was sitting to the table, and when that came up, the superintendent said that they wouldn't eat it even if we got it in there. And we had an 8-year-old that said to the superintendent, you don't know what we'll eat. You don't trust us to put our food in there. And if you trusted us, we'll show you we could eat it. And that started the venture. And that was like 5 years ago. So it took us to 5 years. Dr. Bridgers, now our superintendent, that allowed our youth this year to do their own summer feeding sites with one of the school system working with them preparing the food for the garden. So this would be the first year that that school system would take the vegetables from the garden, because they learn how to prepare it over the summer, and now to put it in the school system. You know, these processes don't happen overnight, but if you stick with them, it'll work. And so it took 5 years, and then there are like this different specs you got to get, the GAP certification and other certification, that you got to secure those certifications and the packaging of your food. So it's over a period of time. But I tell anybody, friendship and relationship will get you there.
Thank you. So this table right here.
First of all, I want to say thank you for sharing your story. It gave me a sense of hope, so thank you. Our question was, if you had a chance to do it all over again, what would you do different?
I wouldn't hang around old preachers. If I had to do it all over again, I would, I don't know, I would try to be more honest and committed up front. And I would pay special attention to the children early on. And I would make sure that everything we do stays within the community is done in. I would make sure those things. And I work harder on administration. That's one of the pieces you really have to watch.
I'll ask him a question from this side. We talk a lot about community buy-in from the beginning, not telling a community or a sector of society what they are supposed to do. Sort of they come up with the solution or the problem, and we kind of generate a solution. You kind of said or alluded to that you came up with the solution for the community. How did you get the community buy-in when you were basically telling them, hey, look, I think this is our way out?
You know, and Pastor Burnett can tell you that you can't count out pastors. Being there, burying their dead, being with them, trying to help meet their needs, and doing it without asking them for any pay. I made sure that the church don't pay me and the people don't pay me. I made sure that I wanted to pay forward to them. And so when I shared with them this idea, it wasn't that I was sharing it with strangers. I had sit beside their bedsides. I had held their hands, and we shed tears together. And you got to get people to trust you. Trust is not easily gotten. It can be easily lost. And so when I went back to them and said, this is what God has spoken to me, and I don't like it, and really changing their food, changing fried chicken in the Baptist church. Now, come on, I almost got voted out just on the fried chicken part. And so, but it's risky. The buy-in, and I showed up every single day. I showed up, I was there, excuse my expression, I took the ass whooping, and I kept coming back. And they finally said, maybe he been initiated enough. He ain't going nowhere. Because people in pain don't know how not to inflict pain. People in pain do not know how not to inflict pain. So you got to endure the pain that they inflict upon you. And I can tell you that when the church told me, we cannot pay you for what you're doing, and they cut the salary, got rid of the salary, and I kept coming. And they finally said, this fool coming back and we ain't paying him. Either God is with him or he's really crazy. But you got to be willing. I mean, you know, when you say you want to take on this, you probably don't know what you're saying anyway, but be clear that, you know, because the cost is not cheap, right? And so it's that process. If I wasn't there with them and I just showed up to say this is how you can do it and didn't do it, you know, it wouldn't have happened.
Thank you. So this table right here.
Our question is, how did you go about getting into the hospital system?
My mom always said I was a manipulator. Well, one of the ways of getting into the hospital was I was director of pastoral care chaplain there, and I knew the challenges of the hospital. We were losing money out of 30-day readmits. We were losing money on hospital being used for primary health care. We were losing money through poor discharges. And so we literally said to the hospital, if you buy food from us, we don't want your grants. And so they bid into it. And so they began to purchase food. It gave us an income that made us self-sustainable. And the level of food that they need is more than any one garden can provide. So they can buy enough food from all of our gardens to sustain not only the gardens, but the programs, which is critically important. And it taught us social skills. So it takes a lot of social skills to package 200 boxes a week, grow the food, fight the gnats, fight the bugs, and keep the food organic. That take a lot of skills, plus putting food on people's table. And so, and the hospital saw the results. They ran the zip code. They ran the zip code of Canita, and they found out that doing this program reduced the primary health care for emergency room over 90%. They saw an 80% reduction in 30-day readmits, and they looked at the dollars. So it was evidence-based, right? So when we went, and then it didn't cost them nothing but to buy the food, right? So it gave us a relationship. And so I think you got it, and even for the school system, they saw the suspension going down. They saw children coming to school ready for the education of the day. They saw people that had been put on ADD medicine, and they saw that that was a social thing and not a mental thing. So you changed the environment, changed the food, changed the mobility, and you changed the child. And so they saw them children coming to school ready for the education of the day. It makes sense to buy the food, right? And so you gotta know what your system want, and you gotta be able to provide it for them, and then give them a cheap way out.
Okay, we've got time for one more question. Mike, I think we're back to your side of the room. If there's anybody that has a question they would like to ask. If not, we can pass it this way if there's any back there. Any back there with you, Mike? All right, then we'll one question here, and this will be the final one, and then we'll do lunch.
Reverend Joyer, thank you for joining us today. We are most impressed with what you've done there. You've had 14 years to do it. So for us to start, and we really have started in a lot of different ways. In fact, we've got several different groups, I think, that want to start a community garden. What would you recommend for us? You know a little bit about us. What would you recommend for us as a starting point for what we need to do next?
I would find that 92-year-old man and teach him how to pass the mic. But no, I would say build relationships. I said the first thing you do before, I would just say build the relationship. Go in, sit down, get to know the people, and share with them, listen to them, and ask them, you know, can we do this together? I found out if you build the relationship will open the door to where you need to go, right? If you build the relationship, right, and just build the relationship. You might have to eat a little fried chicken to start with, but don't let it stay, right? Just, I would say, relationship building and building trust. Miss Minnie Pearl, who is my best friend in the garden, she's 84 years old now. When we first started this, her vow was to get me voted out of the church. And she told me, she was up front, she said, my goal is to get you out of this church because you messing in our business. And we didn't bring you here to do that. And we built the relationship. And we kept talking, kept praying together. She came off 21 medications. And she worked every day in the garden. And she'll tell people now, he's not going, I can talk about him, but better not nobody else talk about him. And it literally came out of our relationship. She wouldn't have changed that if we didn't build relationships. I mean, we got to build relationships about race. You know, we got to tell the truth about race. We got to tell the truth about privilege. We got to tell the truth about equity, but relationships. So thank you so much.
Great. Can I say one last thing? Yes, I'll walk over to you. A quick Susan story.
Oh, Lord.
How many of you remember the Health Resource Center? The Health Resource Center did some amazing things in our community. There was a discussion that Susan and Dennis Lofi, then the head of the whole hospital, had, and it was a division between whether there should be blowers in the bathroom or hand towels in the bathroom. So sometimes we can let a little thing cause a big division. You know what was in the bathroom? Both. Because Susan and Dennis found a way to work together. Susan and I have resolved that this issue is so big, we're working together on this thing. And we thank you for coming again.
Thank you, Donnie. Yes. Oh, Lordy. Hand towels or hot heat? Whew. You need both, right. So thank you so much for your wonderful, reflective questions. Donnie, thank you for taking me back 20 years. The food is ready. So I'm going to look to the two amazing preachers that are here, Reverend Joyner, Reverend Bennett. Do you want to co-pray or whatever? We would love to have our prayer before we eat. Hang on. Mike, is there a... Let me give you this mic. Here, Reverend Bennett. Thank you. Thank you. Are you fighting over who's older? Is that what it was?
No argument for me. Shall we pray? Father, how we honor you and we are grateful for this day and moment. We thank you for this time of our gathering, and we thank you for this time now, Lord, as we partake of the food that has been prepared. Bless it in a very special way. Thank you for these, our bodies. Thank you for giving us appetite to even enjoy. Bless it now for your glory and to your glory. For it is in Christ Jesus' name we pray. Amen.